Dr. Joaquim has served as the IVAS Board of Directors from 2014 to 2016, and the World Association of Traditional Chinese Veterinary Medicine Board of Directors from 2014 to 2017. He works in the Veterinary of Acupuncture Service on Sao Paulo State University, working with stem cell, neurology, rehabilitation, and pain management, and is the scientific coordinator of Bioethicus Institute. He has had the privilege of lecturing in Portugal, Venezuela, Chile, Costa Rica, Colombia, Argentina, Germany, the USA, Russia, and beyond, and is the current president of the Brazilian Veterinary Ozone Therapy Association. I think it's probably safe to say that he's probably he's the most qualified of all of us to speak on these ozone therapy issues, just because of his deep involvement in both the research and the clinical side of things. So I'm delighted to be able to present him. I'm interested to see how you're going to do all this in 30 minutes, Dr. Jean, but that's the challenge before you. So good luck on that. I'm going to turn it right over to you, and we look forward to hearing what you have to say.
Well, thank you, Jonathan, for the introduction. Thank you all for being here. And I hope I can tell you something about new research update. We have a few minutes, but I will try to hurry and say something that be useful for all of you. And after all, I will be available for discussing questions. Well, it's ozone, a science. If you go to PubMed, you can find over 3,000 papers about ozone therapy. I don't know if the screen is okay. Yes. So we have a lot of papers on PubMed about ozone therapy. And
Dr. Jean, I'm sorry. Can you start your presentation? I think that'll help with us seeing the screen. So if you...
Yes, I was...
Hit the play, yeah.
Looking at that.
If possible.
Yep,
you were right there. You almost had it. Just click on that play button down where you were. It's not quite...
It's because I'm using two screens. Now it's okay?
There we go. I think, there we go. Yep, now we're good. Thank you.
Okay. If you go to Google Academic, we can have over 100,000 papers on ozone therapy. So, of course, this is science. And if you go for meloxicam, we have just 2,000 on PubMed. So it's a well-known product that we use a lot, but we still have less research on this comparing to ozone therapy. Use and indication. We have some paper of us that shows and highlights the use of ozone on neurology and on orthopedical problems. As we can see, we use about 50% of the time ozone as a therapy for orthopedical issues. On this, also on this paper, that it's a study of rehabilitation of musculoskeletal disease on our service. You can also see we use a lot of ozone therapy for rehabilitation. And recently, because almost those papers that we are going to talk about are from 2020, we have a review about the use of ozone therapy in veterinary medicine. So nowadays, these reviews are getting more and more common, and those reviews are very interesting because they bring the idea of the use of ozone therapy not only for wounds, that is, I think, is the main reason for using ozone therapy in the beginning, but now those reviews shows that ozone can be used not only in wound disease or skin disease, but you can also use this for internal medicine, neurological problems, orthopedical problems, and others. This is another paper from Romania, from 2020 as well, that talks about the use of ozone therapy in veterinary medicine and talk about the via of use So the different techniques of ozone therapy. That's a really nice aspect of ozone therapy, because we can use this as bagging, as cupping, local subcutaneous or intramuscular, as minor auto-hemotherapy, rectal insufflation. We can use this intravaginal, intraauricular, oral. So we have a different kind of via according to the different kind of the disease or the species. Ozone is safety. Well, this recent paper shows some safety pitfalls about ozone therapy. And they highlight the use of ozone in human medicine for more than 40 years, which demonstrate the safety of this method. And despite it being safety, ozone is very cheap. So this is very important for human health system, because it's not expensive. So if you are going to use this in a large population, despite being safe, useful, effective, it's cheap. This is another really nice paper from Brazil from 2020 that shows the use of ozone in horse and shows that we don't have changes in biochemical evaluation. Ozone increased red blood cell count and hemoglobin, and could also change rheological properties of the blood. This is one of the first and well-done research on ozone intrarectal in horses. So they evaluated the transrectal medicinal ozone in horses. Because we have a lot of use, we have a lot of reports, but we don't have a study that shows, like in humans, the safety of using this in horse. And as we were discussing before, you can see the dose is very conservative. Even for transrectal, that's painless, they just use 20 micrograms. About the dose that we were discussing, this is the protocol from the Madrid Association, that the idea of the unification of criteria in the practice of ozone therapy. And in 2020, they included the veterinary medicine. On the oldest protocols, they don't talk about vet medicine. But now, with some friends from Brazil as well, they decided some dose protocol which can drive you to the right use of doses in veterinary medicine. So we have doses for intraarticular, paravertebral, subcutaneous use. So it's a very nice protocol for veterinary doses of ozone. This is another nice paper from 2020 that talks about a problem with ozone and discuss the dose, because they say that 40 microgram per milliliter can injure the cells from the central nervous system. We know that ozone can be very useful in back pain, disc disease. So why we should use conservative doses? Because if you go over it, instead of causing a therapeutic effect, you can cause some kind of injury. So this is a very nice paper about this discussion of doses. When I mean doses, I'm mostly focused on concentration than dose, because those are concentration multiplied per volume. So dose is not so important as concentration, but we can discuss this after all. Clinical application, we have some antimicrobial effects. This is a nice paper from 2020 talking about the use of oils, ozonated oils, for methicillin-resistant Staphylococcus aureus. This is important for diabetics wound in human, because mostly they can get contaminated with this kind of bacteria, and they could achieve the healing of those infected diabetic foot wounds with this ozonated oil. So it's a really nice paper that brings some light in the control of diabetes wound, principally in human being, but we can also apply this for common wounding situations in veterinary medicine. We have another others papers about infection. This is about leishmaniasis in Brazil, and we have 2 or 3 papers on this issue and ozone therapy, but this is from 2020. This is one about echinococcosis in human being. We have a lot of papers about coronavirus, which are increasing. Every month we see a new paper about this disease and the ozone in the treatment and control or avoiding some problems with COVID-19. So we have a lot of them. This is a nice paper talking about ozone therapy in feline viral immunodeficiency. This is a small report that now it's a big one because we have more and more cats treated with this protocol. The protocol used was this one. I can share with you after all if you want. And we have another paper from this year from our friends from Romania, Dr. Kalin, that also addresses the problem with feline immunodeficiency in cats. So we are going to different kinds of situations that we can use ozone, from coronavirus in the humans to feline immunodeficiency to horses, infected wounds. So ozone is very interesting because it can use in different situations with different species and with the same results, always with good results in the control of this infected wound. In this paper, they found 93% of control of this disease. This is the bagging technique they talk about in the paper and the way we do this in Brazil. We also have papers about ozone and dermatology. This is a nice paper because it discusses the mechanism of action involved in ozone therapy in skin. So we can have some idea of the biochemical behind ozone action. And those kinds of papers are very important because most of the paper, they show the effect of ozone therapy, just like with acupuncture and other complementary medicine, but there is a lack of explanation on how does it works. So we have a lot of biochemical on these papers highlighting the mechanism behind ozone therapy and the expression of interleukins that are going to help the immune system to defeat those infections on the skin or other organs. This is a nice paper about an equipment that you put over the wound and it starts to spread ozone gas on the wound. This is a nice paper because it involves high technology, and despite in controlling the infection, despite in healing the wound, they also say that ozone was not cytotoxic for the human tissue. This is important. So it was effective, it could control Pasteurella aeruginosa, Staphylococcus epidermidis, and also has safety. So it's a really nice paper. This is another paper talking about wound healing in equine lower limb with ozonated oil. And this is a nice paper because they show it on histopathological histopathological technique. So it's a very simple but very well done and a well done developed paper. This is another paper talking about the ozone in veterinary medicine, talking about the use of ozone in healing wounds in small animals. So it's a nice paper from Poland that highlights the use of ozone in wound healing. This is a paper of us that talks about the use of ozone in skin infection. Despite in treating the infection, we have cultivated the bacteria that was on those dogs, so we can show that we have an infection. We can check what kind of bacteria we have. We can check bacterial antibiotics resistance. And after all, we can have a proof that ozone was really effective in treating those skin infections. And this is what we want. This is a lesion caused by spider biting, and we have used ozone oil. It's about 15 days from this to this. Ozone for osteoarthritis, we have some papers that compare ozone with shockwave. Well, this is a simple case of epicondylitis. We have treated many of these cases with easily treat, but this paper is interesting because it compares shockwave. That's very effective, but it is very expensive. So they conclude that both could cause pain relief, but ozone was superior in the long-term evaluation and pain control, and it's much more cheaper than a shockwave equipment. This is a nice paper on ozone treatment of knee osteoarthritis. This is also a new paper from the magazine Arthroscopy, and it highlights the safety, the pain control, and the functional recovery. And again, we have stem cells, we have PRP, but ozone is safe and very, very cost effective because it's very cheap. The mechanism of ozone in osteoarthritis have been elucidated with the years. So we can have the oxidation or adaptation to oxidative stress caused by osteoarthritis. We can have the stimulation of the endogenous antioxidant system. We have the normalization of the redox balance. We have the inhibition of the release of pro-inflammatory cytokines. So we have a lot of mechanisms involved on this. So when I go to a tiger with a knee osteoarthritis like this with ozone, I can have pain relief, disappearance of edema, increase in mobility, and delay the degenerative process. We can almost stop the degenerative process. Another nice paper on articular injection of ozone in gonarthrosis. As we were discussing about doses and concentration, they use 10 to 20 micrograms per milliliter. This is a common concentration for intra-articular use. And the volume goes from 5 to 15 milliliters intra-articular. So this is a very common dose used or concentration used for intra-articular infiltration. We use the same concentration for dogs as well. This is a nice paper comparing ozone with PRP. We use a lot of this ozone combined with PRP for intra-articular infiltration. We do a lot of that on my routine, and it's very effective. We can use both together. We can use both. We can use them separated, but together is more effective. This is a nice paper as well, comparing intra-articular ozone with placebo in the treatment of osteoarthritis. And they conclude the effectiveness of this 20 microgram per milliliter concentration of ozone for intra-articular treatment of osteoarthritis. As I told you, the 20 microgram per milliliters is the most used concentration for intra-articular use of ozone. We have some papers on osteomyelitis showing the benefits of using ozone on infection wounds. Even if you don't do rehabilitation, you just do surgery, or you work in a hospital with many cases of surgery for orthopedic problems, you can use ozone as well. You can wash the wounds with ozonated saline and have the benefits of myelitis control. This is a paper on rats. They induced experimental osteomyelitis and could control the infection. This is a real case where we have an external fixator for a fracture, and it was infected, and instead of taking out this external fixator, we just did bagging associated with antibiotics, and we could heal the dog instead of making the surgery again. This is a recent report on the use of ozone therapy in the treatment of osteomyelitis in a man with a skin wound close to the lumbar area caused by paralysis and hospitalization. And they have used ozone to control it. And this is a nice one paper on ozonated water lavage. As I told you, we can do for orthopedic wounds, combined with vacuum-sealed drainage in the treatment of 18 cases of chronic osteomyelitis. So this is a very nice paper on humans. It's from 2021. Immunomediated articular injuries, some papers from Russia, some research showing the decrease of some pro-inflammatory interleukins. So they show the mechanism of action of ozone in the control of these immunomediated osteoarthritis that we can call rheumatoid arthritis. This is another paper from Brazil. It's a systematic review on the use of ozone on rheumatoid osteoarthritis, which also shows the effectivity and the benefits of ozone on this kind of situation. This is another paper from 2021 talking about the use of ozone in rheumatoid osteoarthritis as well. And this is what we do in practice. We use thermal camera to highlight the inflammation, that red that you saw. And then we go with ozone. The video is not running, so periarticular. Well, the video is not running, so I go forward with this. But you can see that we use this periarticular close to the joints that are affected with the osteoarthritis. So it's very comfortable. The dog is not complaining. And we use low concentration of ozone. And we can associate this with laser or other techniques you want. Studies in veterinary medicine. This is a nice study from Brazil showing the use of ozone on hip dysplasia. We also check with thermal camera. This is a nice paper from Brazil as well, from our group in the university, showing the use of ozone together with hyaluronic acid. They can be used together, they can be used apart, and ozone was more effective on kinetic evaluation comparing to hyaluronic acid. That is a common treatment and well-known and well-accepted treatment for canine osteoarthritis. So a very nice paper on ozone intra-articular in dogs. We have just few papers that talk about this. And this is the way we use ozone intra-articular. Sometimes we use stem cells as well, not in the same time, but we can put them together. Of course, for these intra-articular proceedings, the animals must be sedated. It's not painful, but can be very uncomfortable.
And this
is a nice paper from Brazil that highlights the use of ozone in equine joints and the safety of this. Again, we have the 20 microgram per milliliter, the volume used, and they have done some analysis of a lot of interleukins, a lot of chemical substance in the joint to conclude that ozone did not cause inflammation or degradation of the cartilage, and it's safe at the doses evaluated. We are on time, Jonathan?
Yeah, we have about 5 minutes.
Okay. Ozone for neurological disorders, we have been, there is a lot of papers that talk about the use of ozone on disc disease on human beings, and they do this directly on the disc, but recently we started to have this on dogs. So this is really new on veterinary medicine, but they are doing this in human medicine for a long time ago. I have a PhD student that we are trying to describe the method for doing this. We also use CT and a fluoroscope to perform that, and it's a very effective technique for disc disease. This is a nice paper talking about the neuroprotective effect of ozone in spinal cord injury. So this paper is really nice because it highlights this effect on spinal cord injury model, and we can use ozone together with conventional treatment as another tool to try to avoid the problems we have with spinal cord injury and the neurodegenerative process behind those injuries. This is another nice paper that talks about the ozone use in case of cerebral vasospasm, that it's the stroke, the famous stroke. So they highlight the effect of ozone on the brain circulation and how we can improve brain circulation after stroke. So it's a nice paper as well. Another papers on effect of ozone on avoiding the neurodegenerative disorders, which could be used in vet medicine for our old dogs, for the dogs with cognitive impairments. So we have a lot of papers showing this antioxidant property of the ozone and the use of the ozone to prevent neurodegenerative disease in vet medicine and also in human medicine. These papers address the same thing, the neuroprotective effect of ozone, reducing oxidative stress, apoptosis, gliosis, that is a kind of scar in the central nervous system, improving neurogenesis and cholinergic plasticity. This is another paper on stroke, So a lot of papers recently published on this issue of ozone in the central nervous system as a protector of the neurodegenerative disease. This reproduction we have published this year with our group, talking about the use of ozone intrauterine in mares, which is an empirical use, very common in Brazil for metrites, and we are trying to understand the effect of the ozone in the uterus of the mare. We have a lot of papers on metrites in cows, in bovine, but not so many papers on the mare, despite the high use of ozone therapy for metrites in equine medicine. There's another paper on bovine, and it's a nice paper that shows the improvement of fertility after ozone therapy in the repeat breeders' call. And this is another paper talking about ozone to reduce subclinical endometritis in dairy cows. So we have a lot of new papers on reproduction, well designed, showing the effect of ozone on the control of reproductive infections.
And we've got just a minute or two left, Dr. Joaquin.
Okay. So with all these papers, we jump to a conclusion that we have more papers in human medicine than in veterinary medicine nowadays, which is very rare. Normally we have a lot of papers with animals, but with ozone, we have a lot of papers being done in human medicine, principally in orthopedic disease or neurological disease. But the quantity of papers in veterinary medicine is going high and high year after year. The quality and quantity of ozone therapy research has been increasing. We have a lot of papers with bad quality, but now we are changing this. A lot of good researchers, universities are getting interested in ozone therapy. And ozone research is becoming more specific and focused on the mechanism of action. As I told you, we have a lot of papers that shows the effect on wound healing, on pain control in osteoarthritis, in metrites, infection, in mares, cows, but the mechanism behind of this are still complex. So the new research is coming, are bringing light on the mechanism of action. And when you can explain the mechanism of action, ozone therapy can be more accepted for or by the scientific community. Thank you. I hope you could understand my English, and I hope I can show you some evidence of ozone therapy from a scientific point of view.